We're live.
Thank you.
Senate Appropriations. And we're continuing our work on the 2023 budget. And so our first, we have more language that we need to review. And so the first is some draft language from Senator Westman regarding the STARS.
The first A is regarding the STARS program. As we've said, STARS has been in place now for nearly 20 years. And what the DCF and the Child Care Division are doing is they're severing the contract with the Family Center in Middlebury that does the reviews for increasing STARS in their position, and they're putting a moratorium on for the year. They will move in-house the review, so if a child care center, their position changes and they've got the education level to move up in STARS, they will be able to do it, but they're taking it in-house. During that year's time that they're doing it, they are going to be reviewing the criteria for STARS, and they are going to be recommending changes. My understanding is they don't plan on implementing those changes to July of 2023. So what this language does is it asks them to come back to the policy committees, Health and Welfare in the Senate and Health and Human Services in the House, and present the policy around that, and that through the budget process, they would get approval and not just move ahead without that. They, I heard back from the Child Care Division, they wanted to go through LCAR and through the process. I ran this by the chair of Health and Welfare and the senator from Addison. They like this language. And the second piece takes the language that was in the budget that we had such concerns about, because it basically calls for a review of the new financial system to hand money back to participants. It changes the dates and basically says that until we fully fund the new fee structure that we put in place, and they get the IT system in place, until that, we don't ask for a report until 6 months after that time. If we do set a date of January 1st, 2024, as you remember, it was October of 2024. So this just, I think, puts it in a place.
This moves it up from October to January.
Yeah, and says, but if you don't have the IT system put in place, and you don't, and we haven't fully funded the new funding system for this, that we don't ask for a review of what we're doing. What we wanted, I think the intent of this from the beginning was do a review after we have some experience.
I'm just,
Yes.
Can I clarify one thing?
Yes.
It all looks good to me, but I'm wondering, under section B.
Yep.
So, and you just said this in other words, but the date seems kind of irrelevant because it's whichever is later occurring. So it's either the date or 6 months after modernization of the system, ... So if they never modernize the system, we'd never get a report.
They're in the process of modernizing the system now. They have the money to do it. They're just behind.
Well, what I'm wondering is, what if we said whichever is first occurring?
I'm fine with that.
And that way we'd at least get it by January 1st.
I'm fine with that.
Because otherwise I'm thinking about that SSDMS system, which is now stretched out 6 years. And now they're talking about canceling it, and we're just now writing to get a report. So it seems like if something is going wrong, it would be good to get the report.
Yeah. Yeah, I'm fine with it.
That's right. Thank you for
Fine
bringing
with
that
that.
subject up, right?
Sorry, it's a sore spot.
But,
Yeah, it is.
but
And 2.9 million, was it, got spent?
1.9,
Oh, 1.9.
which is still a lot.
I'm kind of, you know, the intent of this is if we've got the new funding system for families to get their kids to childcare. And the two things that need to happen to facilitate that are the IT system and fully funding it.
Yeah.
There's no sense asking for a report before you have those two things done,
So
Well,
let me,
unless.
If we say first occurring though, it makes that date
Yep.
so where you would like to add the phrase is,
line 20.
and it was
Instead of later, it would say first,
whichever,
is first occurring.
Sounds great.
Does that sound all right, Stephanie?
Because I didn't have a copy of that.
Oh, you
Oh,
don't?
here,
whichever.
And council, you know, Jen and Katie will review it too before we're done.
I don't think
this
it's,
was
So it's
Katie's
line
language,
20.
yeah, so it just said
Replace
whichever
later.
is first occurring, so later is just replaced with first. I don't think that should be too much of a, okay, so other comments, committee, otherwise, I think we have all sort of, for years, been told this is the best system in the world, and reimbursement has been built around it, and all of a sudden it's being jettisoned, and I do have a request from DCF, they want to talk to me. I guess you're saying they don't like the language, they would prefer to go through rulemaking. The dilemma that puts legislators in is members of that committee have to evaluate rules to determine whether they're consistent with legislative intent. And our intent is very clearly to support the STAR system.
Right.
So I don't see that as, maybe that's their preferred route, but I think that puts LCAR in a difficult position of second guessing the intent, or to say this isn't consistent with intent because of all the language we've got.
well,
So-
quite frankly, I think the policy committees in this legislature, when you're changing something that has been that direction, are the best places to learn.
So, so committee, with that one change, shall we accept this?
Yes.
All right, what's next?
So
So we go to the money now, or do we have more language?
the only update piece I have on language is on the cannabis construct that we adopted yesterday here. There is some concern about having the excise tax available to the Cannabis Control Board for the long term. And so the idea would be to have the excise tax go back to the general fund at the end of 2025, so the board is ramped up for 3 years. And then we'll see clearly whether or not we still have a significant deficit, and you would be in the position of funding that directly with general fund after 3 years.
So do you have revised language?
It's simply, you know, going back, Anthea has drafted, or I don't print out a copy, but it's simply in July 1st, 2025, we're back to the underlying language that we were struck out. That's what would be happening.
So, I mean, really what we're attempting to do
Or add
is
it,
during this
right.
phase-up period, that, you know, the issue of
And
growing
then 30% of the prevention would be on the full excise tax
And
amount.
just some background of why Stephanie's rolling this out, we got communication back from the administration around how we were proposing it. They were concerned on the impact it would have on prevention dollars, relatively modest. I think it was 300.
400,000.
Well, it's right here in front of me.
Yeah.
Um,
About, it's actually not calculated on that sheet, but the difference in the
No,
second year.
that's why I don't see that number. So this would still get us to where we're concerned, and that is not having a growing internal service deficit.
Yeah, an internal deficit of
I mean,
$7 million for
internal
3 years.
deficit, not service, internal deficit. So
So that's the one that you would see in the bill. The amendments we adopted yesterday, and then in 2025, going back
just
to
add that
the.
language, yeah, that's fine, because by then we should be in a very different fiscal environment.
And we're operating under estimates on all the cannabis pieces right now. for revenue. And we'll have a much clearer picture of what the actual steady state of revenue is, both on the fees and on the excise tax.
So committee, we're all set with just putting in that date. And heaven knows what the world will look like in 2025.
You're going to spend most of your time today on the remaining general fund one time, but I have to hand out just the worksheet we did yesterday, updated with your decisions to date. The open item that I had, the two open items that I had, I think, were the positions in Dale that we had held the $100,000 UVM AIDS clinic open. The other, we have carried the amount of money that's the net SUD recovery, but we didn't walk through the details of that. And I don't know if Senator Westman wants to walk through the details with the committee of the SUD proposal.
Well, shall we just go through, so what we have is, the administration is very concerned about no positions to really do the oversight and make sure that people in facilities are getting proper care. We have proposed 6, and they were, those are the positions that would go out and visit the facilities, do the survey and so forth and respond. And then Stephanie looked at what was requested, and some were administrative, like administrative assistant or assistant director or something.
There's a manager,
Manager.
assistant.
So do you want to take your position now, Senator Beth?
So, I think Sarah can help me, because we just sat down with Dale. There's a position, for, public guardian, which was their number one, because the caseloads, for public guardian are far and away.
Well, that was one of the.
I thought they were adding 2.
They said 1.
They need absolutely one of them, is what you're saying.
Yeah.
And that was in one of the 6. So.
Well, and one of the 6, and then there are 5 positions that they are more portrayed towards doing res care in that. So they have something broader than that they do, but those 5 positions, so those are the 6 positions that that we.
Okay, so it sounds like the 3 nurse surveyors would be in the 6.
Yep.
So
And one of the investigators being the 6, or you have them all in the bill laid out.
We don't, and the other 4 we would not do.
Okay,
so
so the E100, they're all.
we're gonna do 6 positions out of the 10.
Okay.
And they would be the ones that we just talked about. So once Stephanie, just make sure that we've got the 6 that we intend, but there are 4
So they
surveyors.
would keep the manager, the 3 nurse surveyors, and the 1. This adds up to 5.
Yep, and then the 6 would be the public guardian.
So they would, the 4 that would be going would be the outcome specialist and the 2 adult protective service investigators and 1 public guardian.
What is
The 1 public guardian we want to keep.
We could keep 1, we're only gonna create 1, and they were creating 2. Okay.
what is the manager?
And we will calculate the dollar value of those based on the ups and downs.
Isn't there already a manager? Because they do survey and cert now.
This is their priorities.
Yeah, I said,
Well,
All right.
give us your top
All right,
priorities.
I don't want to second guess the administrative agency in terms of where they need the workforce. Sometimes you need to have oversight of the work that you're getting.
So we'll make the positions that are in the bill match that.
Okay, so you're talking about a total of 6, and the money would change a little bit.
Probably we have to go through the details of it, because some of them are matched, some of them aren't matched.
Yeah, okay. All right, so we've agreed on that. We will agree
We'll
to
fill in the
6.
dollar amount.
Yeah, and fill in the dollar amount. The other ones we have here, I think we had sort of closed out everything.
Yeah, I think the only one I thought was still open was the 100 at UVM, but and the 807, which actually I think has 250 or 750 after it as well. That dollar amount is is a net of several moving pieces, and I wanted to know if the committee wanted to work through, understand the moving pieces in the SUD proposal.
Yes. It's gonna impact this.
Yeah, it's what leads to that.
Are you ready to do that now?
Well, I would say that there's two pieces to this. There's,
One
nurse,
time and days?
in the 100,000, there is, 50,000 is for nurses that go out and draw blood
Oh,
and then come back. And I wouldn't wanna,
This is the mobile map.
yeah, this is the mobile map, because you asked about that. The second piece is they're seeing a higher acuity of people that are having mental health issues since COVID, that are in AIDS population, and that second 50,000 is that.
Is that enough? Do you support the need for the money?
Well, the only thing, Sarah, did you have what the health department came back with?
In terms of the details behind that request,
Yeah, or
Or did they take a position on
Did
it?
they
they
didn't
take,
take a position. They said it's separate from what was in the governor's recommend.
That's
and
all
what
right
did
there.
did they say anything about what's in the governor's recommend?
That's not there.
The mobile map was not in the governor's recommend, it's an increase. So that was all contained in the House 728 bill.
Correct. I would say that this has been going on, particularly, the mental health piece is an add-on, but the drawing of the blood has always been there. I'm all for that. I don't know what to say. Yes, I would support the whole thing. It's such a small.
All right, well, it might help you to know how much we have available.
Yep.
And so what we have here, without the 100, the
Sorry.
12.9 does not include the 100, is that correct?
So Senator Westman, there's the sheet we put together on the SUD pieces, and those are different from the House and they're different from the governor. And I just don't think the committee's talked about
Well,
what the Senate position would be. We're carrying it right
So,
now.
all right, Stephanie, I'm willing to go there, but is the 100,000 that we just discussed part of your proposal?
no.
It's part of the one-time proposal in your, right?
That was not in, because this is all separate from that piece. So this was a separate, that 100,000 was a separate request out from.
All right, then we may have a problem of, we have more on the sheet than we've got money.
Okay.
Depending on-
So it is a ongoing request or is it a one-time request?
This.
The
is-
100,000,
I think this is an ongoing request.
okay. So that would increase the amount. What I was aware of is I thought it was on the one-time request side.
Well, the drawing of the blood in that has been pre-existing, so I don't.
They're doing more blood draws, or the money is gone, or what? I don't, well, let's look at your package, because if we
Okay.
add 100,000 here, you may have less, because we're gonna be, let me tell you, we are, the 12.9 does not include, and I
So
think.
it includes an estimated difference of 807 between what the House carried in base items for their SUD recovery package. And it includes some of the syringe and the
You
tower.
talked about what Rich is gonna give us.
Yes, versus what the proposal, as I understood it, and the $100,000 piece was in the one-time version that I had previously
Okay.
seen. That feels like the only piece that's moving, but
Then I'd leave it in the one time.
All right.
for now, okay.
Yep.
All right, that'll make it cleaner.
And,
Sorry, and then do you want to?
Yeah, I think we can get a printout of the sheet. I
Wanna send
think,
it out?
I can send, yeah.
I think Sarah and I can run through it.
Now, just to give you some idea, this is general fund base. So we have 12.9 here, and we have for available funds, in terms of general fund base, is about 12.9,
Well, you have 13, a
little bit more,
yeah.
not
And
too
you
much
will-
more.
when we calculate the numbers on the 4 positions that you are not doing, Dale, that will give you a little bit more room. But what I'm hearing now is everything that's on here fits into that $13 million target, and you're gonna be somewhere in the $400,000 vicinity of available funds in the base.
So,
Yeah, usually anything, down toward the bottom, it's like we had that. Yes,
yeah, we are, that's what we're doing, we're holding, we're not putting it on the base, it's on the one-time funding list. But it just shows you that this is what we identified as our top priorities out of.
I'm sorry, you were talking about entirely this one, the UVM $100,000, not the $100,000 for mobile mat in your.
That's, they're two
Yeah,
they're
two
totally
different
separate.
things.
Okay, I thought you were
They're
talking.
two totally
So
separate.
this isn't on any list.
Yes.
Right, this
Yeah.
is not on any list at this point,
Okay.
and they're totally separate.
I thought we were talking about $100,000 piece in your.
No. In my construct, the mobile
Sorry.
mat is
I'm
a
sorry.
totally different piece.
Although, we would pick up a little bit of money, by reducing the staffing for, Dale.
Mhm.
So the question is, do we want to keep this service?
I would support it.
You know, as I said, particularly the 50,000.
All right, so I'm gonna close it out. We'll move it over. Obviously, it's,
Can I put 50,000 in, the base, I put the other 50, that's the mental health piece, I would put on the one-time list, because this is
well,
specific.
let me say that we are oversubscribed on the one-time list. So, we can put it there and consider it, but it'll be competing with everything else on our one-time list. That's what, it's so hard in this fiscal environment for people to know that we, actually don't have a lot of work wiggle room. And the only reason that we're able to do any of this is because we are asking for more revenues, than the House. So that's where this $13 million is coming from. And they did some legislation that substantially reduced the available revenues for the budget. So this is, we're working in a different box, both our finance committee and our committee. So if you want to, we can move the full 100 over, or we can do the 50 and say, let the mental health piece compete with everything else. And the only thing is, are we getting close to capacity for the room?
I think we're at.
13 is our capacity.
With Chris, I think we're at.
So what's the answer? 50 or 100? I want to put this to bed.
100.
All right. All right, let's go.
Okay, so Chris is getting a copy of the sheet I just think that it's important for the committee to understand the pieces of what you're recommending in the recovery SUV proposal.
Well, this is related, but it's, I don't know what's happening with our, population of patients that are diagnosed with HIV/AIDS, with all the prevention and education. Are we talking about more people needing to be served?
I don't know.
I don't have a sense of whether,
No, one of the things.
I certainly know that we have a lot more drug use, but that doesn't translate necessarily into,
What it was indicated in what they said was that particularly during COVID, that there are a lot of mental health issues with the population.
I understand that.
And a lot of people, quite frankly, in that population that haven't wanted to be out in public, so,
And they don't want to access the mental health treatment system.
mental health or go and get blood drawn or do those things, so.
All right, so
I'm sure we can
it's
ask
all right,
the
we'll,
public health, but to get the trend picture on that.
so I think we've closed it out.
Yep.
We're pretty much down to just, bug us in the scheme of things. And then, of course, there's some things here that we've removed that, will make a difference in terms of what the House is gonna want to negotiate. So we're getting that sheet. Yeah.
Was he just writing down the copy?
He's just running down, I didn't want to miss tracking.
And that would close out the base, and then you've got another one-time worksheet to go through.
But we're doing good with the base. We got.
You're in.
Yeah, we're in the money.
You're in the
No.
$13 million.
This list, we have the money to cover, but not much more.
Do we have the language about?
But
the
do we have
mental
more money
health
coming
and the
from
beds?
finance?
Because that goes
Do we
with
have
the 2
money
million.
coming from?
So finance is working on their bills, but they are working to the same box that
Just,
we are.
are you okay with it? Have you seen it?
All I wanted to do was add those 2 positions. I wanted to,
So
the,
that doesn't count on our side. It's a
Monica
revenue bill, it's not
position
part of their
and
target. It's
someone to represent the recovery.
But it is revenue to help with that, but it's help for their getting to.
So it means it won't help for our purposes.
Yes.
Well, that sucks.
No, oh.
Well, you're both working to the same box. It helps them get to the box
Yeah,
as opposed to helping us, giving us
So
capacity.
because,
some other group gets a tax cut
no,
because
no,
some other groups are paying more for fingerprints.
it just helps them get to their 33 million box as opposed to 50.
I thought it was helping us.
Well, that help has already been sort of embedded in our statement that we're gonna
I wouldn't
spend
have
more.
told you about it if I known they were gonna do that with it. I was surprised it on the floor.
Sure, Virginia.
All right. Who's prepared? Sarah, or who
You want us, Sarah, do you want us down here or do you want us?
to run through your spreadsheet with us, please? Because we've got to go to the one time to get this. The other one.
And I'll just be Senator Ballant for a moment.
So, do you want me to lead or do you
Why
want
don't you lead and I'll,
Okay.
beat it.
What's our maximum capacity?
13.
We're well over that.
No, I think we're okay. 1, 2, we're 12. 1, 2, 3,
You're 8 at the table.
9, 10, 11.
So-
We're exactly 13.
Oh, thank you, Christie.
All right.
So what I'm gonna start with in this, for us, as we work on putting this together, the 2 most important pieces for us, if you look in the top box and where it says Senate base, the recovery centers, where the first door that people go through to
Where are they here?
they are in the first top box in the Senate. They are 1, 2, 3, 4 down
Yeah.
at 540,000.
All right, I thought that was our first priority. Why are you doing it fourth? Anyway.
No,
It's
it's
just the
not.
way they line up to compare
just
from governor over.
I'm
Okay.
pointing
All
out what our priorities were in
Okay.
doing.
All right, that's a priority. Recovery Center's got nothing in the governor's budget and nothing in the House. We're saying they should be increased. So the 540 we've kind of agreed on.
Right.
Residential treatment,
And I say that to back in, our proposal has the substance abuse coalitions at 3 million, but split between one-time and base. These are eligible funds for the cannabis money, so we this year would fund it the $3 million level. We took the 540 out of that money.
Okay.
So you just get an idea of where that comes from, that's why that.
you're
is-
putting in a lot more into the coalitions. Why? Oh,
I think you'll see as we walk down through
no,
this.
but I'm just saying, looking at cross here, the House put in 612 and you're recommending,
The governor had.
I understand what the governor had.
Yep,
So the House had 612. You're proposing why are you doing so much base when we're gonna be in a couple of years? Well, when we start getting those revenues, we can always go in and readjust at that point.
readjust, and that's why I put $1.5
No,
million.
they won't be able to, I can tell you why, because they will say that now that we're getting funding through this source, now you're cutting us in the other source, this was supposed to be over and above, so once you increase that, it'll be seen as a cut,
Mhm.
because they're gonna get new revenue from the cannabis. They will believe, I'm telling you, I may not be here, but that's what you're gonna hear.
Well, we tried, I'm willing to talk about more one-time in this category, but, I think I'm up against it in one time as well as base.
I guess what we're struggling with here is you're proposing base funding of 1.5 for this particular purpose. And I would go back and say, how does that stack up with something that is here or not here? Because we can't look at this independently from
Absolutely.
any of the others. If the one time can be accommodated as sort of bridge funding to when we start getting the revenues.
And that's what we're trying to.
Well, no, not with the base. When you put that in the base, it's gonna create, the very thing is, when is an increase really a cut? Because we would have had everything in the base, because we've got money for prevention in the base now. That's how coalitions are getting funded.
No, I get it.
So, I think that's the concern of the committee. If you wanna switch, I don't know, I mean.
I'm happy to go higher on the one-time side.
My question is, if you had $1.5 million base here, there's not, one of the things that we talked about that's not on here, and that is, if we wanted to do something for people who are on SSI ABD, if we did, say, 1.2 million, would we prefer to provide more financial assistance to that group of elderly than building the base in this, for this particular expenditure? In the context of base, that's what our choices are. Or do we want to raise the reimbursement to 8.5% to mental health? Those are the choices when we're here. And so I need to have the committee.
So I would say, if you look at the spending for the house, if you go down to B312, there are a number of items there. HIV prevention, the money to the Howard Center is 200. Those are all, that would be all eligible for the coalition money. As we talked with the administration, those would compete for that 3 million that's at the top. So there are a number of items here. Within that 3 million
Well,
is all of the 612, which is the tobacco people too. And the.
Well, even if you want to go in and fund those in B312, at what, 560, and say, well, they're really embedded as part of the 1,500. But I just need, to me, this has got to be considered in the same way that we've considered all the other requests for base. And then you've got a fairly big one here, and that's 2 million for residential treatment.
Yes, and what we did in the residential treatment, there are really two pieces to this. There's, if you, the 1.279, which is, these are the lower level beds. Both the House and the governor supported those. What the Senate didn't, what the House didn't do was the 2.45, which was the higher acuity beds. We put that all in this proposal in one lump sum at 2 million.
Okay.
We also have language that we want to put in with that. Here's the language.
So the 2 million that's on for B actually includes.
Includes both the 2.4 and the 1.279. Both of those.
And the House,
The House cut the higher level beds. They did the 1.2, which was the lower.
so you would like to keep the 1.2 and
And on top of it, there would be some for some higher level beds.
How much of an increase is this, Richard?
In total, in the governor's budget,
No,
the 1.2 and the 2.4 were 59 beds across the state between the lower level and the middle level beds.
2.4.
And one of the,
And this is coming, I need to be clear, is this coming from ADAP?
This top box would all be in the ADAP arena.
yes,
Okay, all right, that's all I need to know.
All
So
of it.
this is all the health department
yep,
proposal.
this is all of the health department's proposal. And frankly, the language that we just handed out, we've been trying to sort out what's going on with a public inebriate beds at in the mental health agencies.
I know, and I can't reconcile your comment that Lamoille County had 4 detox beds that went unused and were staffed supposedly. What I juxtaposed to your bill that we've extended and extended around not allowing them to go to correctional centers
Right.
because we don't have the capacity. How could we say they end up in jail and we have 4 empty beds? I having a
Are
hard.
they still ending up in jail? Not in that area, I would hope.
So,
Well, I don't know. I don't know. Maybe we shouldn't have been extending the deadline if we thought.
We stopped extending the deadline and moved it into, we dropped the sunset and made it permanent. We did that a couple years ago.
So,
we talked to Julie Kessler. Their board was meeting yesterday, but Julie told us, and she sent back some language, is that, you know, at Howard, for example, to keep their beds open, they lost $250,000 on those beds last year. And that many of the mental health agencies, the beds aren't full across the state. And
so why are we putting in more beds? Why are we adding 59 more beds if in fact we have beds there that are going unused?
the language asked them to come together.
But you're funding 59 more.
We're not funding 59 more. The governor's full proposal.
How many- well, that-
59.
What is your proposal for?
2 million.
I know, but how many beds?
We leave that open to, the department to figure out. And that's why we put it in this one number, not holding it. And asking them to, sort out this issue of, the mental health beds, the inebriate beds that are out there. If they
Well,
can come
we-
up with some flexibility.
Okay, so maybe we're conflating, I mean, in other words, this would address not only people who need detox, but it would also address other residential treatment needs for people with substance use disorder. So,
200 million, $2
I'm
million.
absolutely confused by what you're trying to do, so.
He's saying a $2 million investment in new bed capacity that the department will figure out between sobering and recovery and new residential treatment mix. And you're going to ask for particularly the public inebriate and the sobering to be understood in terms of existing capacity out there and how it's utilized.
But the,
Right, so 2
the House put
million.
1.2 million in. The governor put the 1.2 plus the 2.5, and we're putting in 2 million.
right.
And so.
No, instead of that.
Instead of
Instead of
that, so we're actually above the House, below the governor.
Yep,
That's,
All right, so,
you just,
but we don't know what the need is that what you're telling us?
well, I don't think we can figure out. I wasn't in a position to go in and say, if we cut the pot down, where would you put the money?
Has anybody talked to the corrections department, which reduced funding for many of these programs and put it into alternative housing first programs? So the corrections department seems to be going in a different direction than the health department. on this one.
Except that these are residential treatment, and I think that corrections were moving away from Dismas House and that
Right,
congregate
that's, I
model.
want those residential treatment.
No, I think they were considered more transitional and congregate housing.
Oh, okay.
I think that's the difference. A lot to keep track of, but I
It
think
is.
that's.
It really is.
It really is a lot.
All right, so in essence, what we're saying is, let the need determine the split in terms of the level of beds. We want to create more residential treatment capacity. And.
And in the backside, if we have these public and need beds that are
Underutilized.
empty, can we figure that out? And can they,
Like, we need to figure it out. If we've got beds that are going empty in this environment, that's very distressing to work.
and if they wanted to use some of that 2 million for that, then I'd be all for it.
All right, so really, the question is, combining the two, recovery housing and residential treatment into one appropriation and asking them to come back with, I guess, what they have funded and where.
Yes, that's good. And still ensuring that if someone gets picked up as a public immigrant, they will go someplace other than to jail.
Yeah, well, and the language doesn't ask them not to, it just asks them to work together and come back.
Well, maybe we should make, if we're gonna put this money out, then maybe we should put that in.
We should.
I'm fine with that.
You don't want them going to jail anymore. It's a big effort to not have to go there.
They don't belong there.
No, I know they don't, but they were being put there because it was the only place that was safe for them.
So do we need to, all right, so,
I'm fine if we put
put
something like
something in
that,
there.
that works for me.
all right. And those are more detox events.
Yeah, they're short term.
Yeah.
They kick them out as soon as they're sober.
Okay, all right.
Is that what sobering beds are? Are they
I
what
think
we used to call detox?
probably. Yes, Nick.
Found that-
Just like SASH, it's not seniors aging safely at home anymore. Oh, I don't know, they came up with it's still SASH, but it doesn't matter, they can change it. I've only got
Yeah,
that
we
in
don't, we
bed.
don't have detox beds anymore. We have
No.
sobering beds.
No, that's right. Okay.
Good, I feel better
All
now.
right, so the question is, the House is putting in a little bit more for residential bed capacity. I think where we're getting into the first is putting money in the base in a time when we know a lot more money is coming into prevention. I mean, we can move it into one time and make it clear.
I think it should be. We should think about this as bridge money.
And then the question is how much that bridge money, because we can you can move a little bit between the two base bridge kind of thing. All right, 880, well, we certainly want it, that includes,
That's the rate increase.
The Valley Vista, the ones that are outside of the 7-8%.
okay, that's what I
Yeah.
was wondering. Okay, we should do that.
Yep.
And that would be Serenity, for example,
Yep.
and
Yep.
Valley Vista.
And that was in the House proposal. And then there's our 540, and the last is Jenna's promise.
Well, you know, I'll express my bias. I did meet with the family, and what they've done is create a response that in fact, if we were designing a system, would be what we would design now. And that is, it's really looking at all the pieces to help someone recover and from education to employment to housing, which are all the areas of transition point when you work between systems, and they put it all together in a package. The House put in 400. They had requested, the governor requested 500. And so this is, we have a choice here. It sounds like a very good program, and the amount of community support and the private contributions to support it. So this is even though it's showing in the base, this is only for 3 years. So it would go away entirely.
So the question is, do you want to go with the governor or go with the House?
I'm more inclined to go with the governor.
If you meet with the family, the Tetros, the passion and the commitment that they've made
They put,
to address, their daughter's tragic death.
and they put all of the life insurance money from their own daughter into this and a ton of their own money. And it is my area and you can't go to the hardware store or almost any store in the area now. You round up in your purchases to support Jenna's Promise. So there's a lot of support for that.
So let's keep going. 728.
So 728 and all of those pieces, and I'm gonna count on
Well,
Sarah.
that's 880. Is that another
We-
880?
We cut
Clear it out
all
on the
of this.
Senate side, you don't
On
leave
the
it
Senate side,
capacity.
we don't do any of that.
Okay.
And a piece of that, and I would say as a blanket piece around all of the mobile unit, all of that, there is already federal grants that they have started doing it. I think, was it the Howard Center that is doing a
Oh,
mobile
that.
unit as a pilot right now? And they very well might be back to us next year if the pilot is working right to expand it. But it was not the recommendation of the health department or,
Well, I'll be very interested. I feel a bit like, I think it's Governor Snelling who said, we can't afford to save this much money. Because all of the times people come back and say, if you invest, you're going to get this in return. And I'm hoping that we will see this. I'm hoping that our additional investment in prevention, it really is going to be a test to see, are we really implementing initiatives that directly, and I'm back to saying, there are things that we know that directly benefit families and kids. And they're mentoring programs where kids have the opportunity, they are after school programs, et cetera. So I'm just hoping at some point the work translates into what are those things that directly kids will benefit from? After school camp, all those things that would be so nice. And so much of what we're doing is putting in bureaucracy. And once you create it, Senator Sears is right, it's gonna be there and it's gonna say we do wonderful things and we wanna be fed, so to speak, literally through funding. And I just feel like we have to always say, how do we try to get directly to the person who would benefit from it? And so, to me, that's gonna be the challenge of prevention. And so many kids will thrive because they've got somebody in their lives that can really help them and make a positive difference. And so we will keep going on this and we'll move the prevention over and do it all as one time, simply because we know that there's going to be a significant amount of money coming. And the legislation envisions that it would max out at $10 million, which is a significant amount, which will lead us into some other language that Senator Westman's been working on. And that is how we use our prevention officer director, which is now Monica Hutt. Our goal was to take all these disparate prevention activities based on, whatever particular issue you were working on, and try to look at our efforts in a much more coordinated way. And so we want to make sure that that position is recognized and does the work that we wanted done when we created it, which was to get rid of, we've got a prevention council for this, and we got a, something else for this, and it's very ad hoc based on whatever issue you're trying to address. So I think that's going to be even more important as we're putting more money in, and that is somehow we think about and as a legislature, we're not very good about it, and that is, what will be the metrics? How will we know that it made any difference in terms of looking at our trends? Would it make a difference? I know that when we had success by 6, the whole thinking was those investments would reduce special ed. I don't think we saw our special ed reduction go down at all. We saw more kids going into special ed. So if you look at those investments relative to that particular outcome, it would say perhaps we have to go back and, retool. So I'm going to move along because we need to. We're down to 295 for AIDS-based support, which is different than the 100,000.
The difference between 100,000.
All right.
That you just did, that you can.
Yep.
So we've just gone through.
And the coalitions, we envision the 360 for syringe exchange, and because there are a number of pieces for syringe exchange. There's already 150,000 in the underlying budget that is syringe exchange statewide. There's a whole piece of the Howard Center 200 that is syringe exchange. So what we did was envision that in the 3 million at the top.
So, I don't think we've changed really the numbers, except to move a one-time recognizing it's a bridge to our cannabis, and recognizing that we want some flexibility, and no one's arguing, well, we don't need more residential and more short-term sobering beds.
I just wanted, so we're following it and we reflect it clearly in the bill. You're talking about the 1.5 that is showing up as the first item in the green base column.
It's going at one time.
All of it, or all but 600 of it, or all?
The 612 was,
The
that
amount,
was the tobacco.
no, the 612 was in the tobacco below, down in the one-time section.
Oh, yeah.
The 612 is what the House left in as
It's the
base.
same amount of money.
They were splitting things. It's just a happenstance of their approach.
Right. And, yeah.
But they did leave 612 as the base general fund amount for the coalition.
Yep.
And so are you saying there's 0 for the coalition of a new add-on, or are you saying some other?
I don't know, let's ask the committee.
Well, I thought our decision was to fund as much as possible at one time. That's pretty.
I think, there are legitimately some base issues, but however the committee wants to break that up at the top,
Well, I wasn't privy to, they just broke it up in half.
And I'm just asking what
we did,
the
we
Senate
just broke it up.
recommendation is.
I'm talking about what the House
Yeah.
did. I don't know. How people feel. Dick, I respect your opinion on this because you work so hard on the cannabis and you understand the money and.
I will, there is one other piece, the 270 that you see in the block on the side over here is what we put in as one time. That 270 is right.
I know what it is, yeah.
Yep, but for the rest of
I
it.
feel that, we have agreed that 30% of revenue from the excise tax goes to prevention. We should bridge our way to when that money starts coming in as best as possible. I realize they're upset. They're already upset about the fact that we've put a construct in that would have the costs of the cannabis, the administration of the Cannabis Control Board come out of the excise tax. I think they thought that was coming out of the general fund. So, we already heard comments about that this morning in judiciary. So people will look at it anyway. I think our commitment to prevention is excellent, and we remain committed to prevention money. The governor had 3.5 million. The House only had 612 million, thousand, and we're talking about 3 million some way, combination of base and one time. So I think that's fine with me, and I think we have to fit it in with what our $13 million construct is.
Okay, well, if.
That's what the attempt was, to fit in that construct.
But then it begs, would there be something you would prefer that base to be used for relative to all the different requests we've got?
I'm trying to understand what Rich is proposing for the recovery centers.
Oh, to give them 540,000 increase.
Which is, their
45.
request was 45,000 per recovery center. And the 540 reflects that. The House put in 1.2 that you see at the bottom, 1.29, but it was all in one-time money. And the governor's proposal had no money for the recovery centers. So, and they haven't had an increase in 5 years.
The House put in a base.
The House put in 540,000 in one time.
In one time.
See, everything in that very lower box is one time in the House world.
Oh, I see that.
All right, well, this committee traditionally, when Senator Bartlett was the chair, Senator Kitchell was the chair, has been the one to support recovery centers. And I think we should continue that
That's what
and
this
do
is.
whatever we can in base funding to increase them. They actually lowball themselves, frankly, for the value that they are to our communities.
I agree.
They are the model of peer
They-
support.
Yeah, and they just seem to ask for the bare minimum. And
Well, and they're the door everybody walks through to get started.
So perhaps, I don't know, did you want to, the recoveries there at 45, their request at 45.
They're built into the base.
Per center, yeah, that was their
Good with
request.
whatever they requested. I don't want to go above what they requested.
No, so the question that
I would.
we would probably close this out. The only thing is, do we want to make it clear that we have 3 million for bridge here
Mhm.
and move that all just to the one time, keep the 2 million, the 880, 540, and keep Jenna's house at 500 and close this out.
I do wanna say, the idea of the 270, which is helping people with addiction that have been through all of their treatment, helping them find jobs and helping them build.
So who is going to do that? Who do you see providing those support? Now, for Jenna's house, it's built into the program. What agency is going to take this on? I don't see the Department of Labor, huh?
It's through both rehab.
It was both
Yeah,
rehab,
it's through
that's
both
where the
rehab.
money's
Okay.
going. And it was one of the top priorities of the, but they
All right, so
basically.
good. I just wanted to know where the money, who would be providing or what
Yeah, it's both
appropriate.
rehab.
All right.
It's a contract with them.
All right, that makes sense, because they're in the business of helping people.
And the
supporting.
idea is versus the house, which they put one time for this, is to get it in a place where there's consistent money to build this going forward.
All right, now,
So what it sounded, you're gonna carry 3 million in that one time over on the right instead of 1.5. That will impact your one-time available money. And the one other complicating factor in comparison to the House is when they did the employment services in the 12 recovery centers, that was all part of 703, so it's within that $27 million box of S703 that we've set aside. So that's not available for your one time unless you lower the 703 box. There's a lot of complicated pieces moving.
What 703 did?
That's the House, the workforce bill from the House, they included that piece in their workforce bill. It was
Oh,
one-time money, but
For
yeah,
employment services in the recovery center?
that's what they were having. gotten in
Why
there.
wouldn't we send the Department of Labor over there with their money on, particularly if they're under
It's not
25?
a recommendation from Senator Westman to do this at all. It's just it's where the House lodged money. And it plays into your available one time for your other general fund.
So we should follow Weston.
No, I'm saying it's, when you move that 1.5 over to the one-time box, it will reduce the amount of one-time you have available.
we understand, but we can, but they're based in one time, one time to base is not, is a problem, but the other way is okay.
But the other thing I would say about this is we put it in one time, but for anybody watching this, it really is about, a bridge to get into the communities.
Recovery Center, as I understand it, the Turning Point Club, works with the local Department of Labor. They send people over there to do this. Why are we funding it? Why is the House funding a new initiative to do what they're already doing?
Maybe that varies, I don't know. It
Maybe they
depends
don't
on the
know they're doing it.
relationship with the VR, which is now hireability. Have you seen the ads?
I'm just asking a question since it's something that they're already doing. I know they're doing it in Bennington.
Well, your recovery's doing it. I think when people get into.
But now we're gonna fund 1.2 million to do what.
No,
they're
no.
doing.
No,
we're
we are doing-
we're
we are doing-
270.
We're doing, and it's one center. So,
Okay,
and it's one-time money, so I suppose we can,
I suppose we can,
Well, it's not even on your construct at all.
I just hope somebody asked
The-
that
the-
question in of the house.
What's,
the 270,250.
oh, yeah, is yours,
Yes,
is yours. I
yes.
thought you were still talking
No,
about
no,
the house
no,
position.
no.
Okay, sorry.
All right, so it's one center. We can try it and see
Yeah.
what it works. We're gonna move the 3 million to bridge, and we can move base for one time. And close this out, because we've got a lot more to do
Okay.
than.
So just, you have just created 1.5 of capacity in your one-time list. In your base list, sorry, in your base list, sorry.
Well, not necessarily. We can use space for one time.
You could,
That's all I'm saying. We don't need to deal with that now.
yeah, we can lower the,
Because we may need it for
And
something
and
else.
the language.
We need to ask the language to, because Alice's point is well taken. If we're bringing these beds online, we don't want people ending up in jail.
No,
And so I don't know, this needs to, this says shall submit a written report. Examining financial models necessary for capacity levels to provide public inebriate and sober.
Every mental health, agency that has these beds is losing money. And
Yes, because sometimes, there sounds like there's too many in your area, but certainly they're the one-time need of nights, not that you need to have so many available, but, you know, it's the UVM student who tons and tons gets
We're-
picked up on the street, they don't want to take them to jail, no place for them. to go.
Totally agree with you.
Created a bed.
but
I'm not sure the language is
Yeah, I
capturing
know.
our discussion. And I think we need to go back and do a little recrafting of the language, because we want to make it clear that with the, whatever additional beds are brought on, that we get a report that tells us whether we have adequate capacity now, and if not, where it's needed and for what level. And so,
Okay.
and also we need to make it clear that, that one of the primary objectives of this additional funding is to make sure that people are, who need a sober bed are getting treated through this, not through our correctional facilities, which has been unfortunate. I don't know if it's still happening. It did happen quite a bit in the past. So Sarah, I don't know who wrote this. Who? Katie. Katie did, well, maybe we can.
Katie,
Maybe
I
Katie
just
did
took
it.
notes, so I'll relay
If
it
you
back to
could
her.
go-
Yeah.
We'll just hold that and
Yeah.
know that we want to revise it and make it a little bit more related to address the fact that the reason we're making this investment is to make sure people end up in a sober, and now they're sober beds as opposed to sobering beds. I wouldn't want to be in a sober bed, would you?
No.
Sober.
That's what it says in statute
You're sober.
when they're referring,
All right,
because the language
All right.
is in the health department.
all right, sober beds.
Already sober.
Okay,
Sober.
so we're gonna do some rewrite. Let's keep going. Thank you, Sarah. And then you'll take care of making,
Yes, I'll update the sheets.
all right. Stephanie, so we're back.
You're back. And so the first sheet you're gonna go through is the B1100 section of the bill. Going down the side here.
Oh, sorry.
It's the big sheet. We basically went over this last Friday. You kind of said everything was open, but there were some that were sort of more clearly closed in that run through.
So
I have some extra copies of it, they're just not big.
we thought this was a good place to start before we go into our next spreadsheet, because obviously this makes a difference in terms of what additional decisions that we can make. Because in the course of our conversation, we've actually made decisions on some of this spending. So it helps us get to sort of peeling the onion. And so if you want to move down through, Stephanie, this is one time, once again, we're not base, we're back to one time. And
This is GF base, and what you see in the first column is the House GF position. And then over on the other side of the line is where the Senate is so far. The first three items are bills that are passed or pending. And so yesterday in our base discussion, we're carrying the reach up bill, which has that system in it, in the one-time section. The House had carried it in the base, so that's simply a move, it's not a change of money. So we're starting with everything that says, which is A1. And this is just the order we walked through the language in last Friday. The ideal.
as Stephanie,
Yeah.
if it's a House bill, a reach-up bill, we have money in the House, didn't?
No, the House accounted for it in the base for some reason. And so we just simply moved it to the one-time list.
Okay.
And so it was a negative 500 in our base construct and a positive 500 here.
Okay.
But we are still leaving capacity for the bill, and the
Mhm.
House did leave capacity for the bill.
Okay.
What I have done, I think the thing that to walk through maybe is the color coding on the right-hand side for the Senate position is anywhere I think you aren't open. So if it's, most of them are the same as the House, where in your walkthrough, even though you said the whole section was open, there were ones that seemed clear, like the ideal, once we got the explanation of it was running through Susanna Davis's for grants out to municipalities, you seem to agree to that. The Ethics Commission backfill, you agreed to. This is not related to the police car, the sergeant at arms retirements and replacements and training requirement. Yep. The judicial safe opening, we're moving to the ARPA section because the decision you made regarding putting part of the IT projects into the contingent position in ARPA created ARPA capacity for you. So you're doing it at the same level of the House, you're just doing it as a different part of the bill. Yeah, so they're getting the total reopening money, the same as the House provided, which was a little bit less than what they had asked for. The Defender General we're leaving in the one-time section. In the Secretary of State's, the election support would be the same. The backfilling for the telehealth lost revenue would be the same. The next group of items in the agency of ag I have open. You were very clear that you were leaving those open for discussion.
Okay. First is ecosystems.
And
Well, that's,
those are payments, I believe.
That's the health and
Payments.
warrants initiative.
yeah,
Oh,
payments to
warrant?
farmers to improve soil quality.
Yeah. Health and warrants.
Yeah.
That's what improves soil quality.
So the question is, do we want to concur with the $1 million? This is one time again, to continue our work on ecosystems.
That money is.
All right, Bobby, do you support it?
Yeah.
You do,
Okay.
all right. Northeast, this is, Northeast, what is Northeast Farm? Is this the CSAs?
No fun.
Yeah, that's.
Yes.
Is it CFAs?
Is this the CSAs for,
This is for local foods and CSAs, that you had the question about low income and who are health challenged. I did get some replacement language from, Diane Rothfeld to make that clearer. They would like, the House did not name NOFA, they would like NOFA named.
The department wants NOFA name.
we don't normally name, do we?
I think we try not to, but
But we
it's,
have been, because we.
it's in this particular program. So that's your choice, but it is,
I don't care. Frankly, at this point, whether we say NOFA or whether we're silent. What
do
does
you,
the
if you want to
committee?
do this $200,000 for this
Yeah.
purpose?
CSAs, all right,
But they're not all focused.
no. PFA, PFAS testing. And that's ag.
And that's in laboratory equipment purchase for PFS.
Okay, I think we, considering all the testing, and we, I think that, yeah.
Should be charged.
I think-
So the one, I left it green, but the one thing I'm showing is we're not gonna do the branding.
No,
piece.
I think we were saying that we would use our 100,000 for maybe helping organic farmers switch to a different,
Non-organic.
Buyer.
no, buy. Oh my God, you'll be getting a letter from James Maloney. No,
Only we can get everybody to switch over.
no,
What has really been else?
it's that organic farms, some of them are gonna have to make modifications in order to get a new milk
Yeah.
purchaser.
Yes, right.
And so we would rather help keep our organic farmers and have a market for their milk than to figure out how we should brand Vermont, which nobody knows where that came from. So do we agree that we would prefer to use the 100,000 a different way? Let's move on.
Yes.
All right, this is a shortfall in crime victims.
So that's the
Yeah.
remaining
Can I
shortfall.
speak a little bit about that, if you don't mind?
Are you back on the positions or are you on this? This
On
is
this
just this,
Center for Crime Victim Services, $2,660,000.
well, because we pulled out and funded the positions. This funded everything.
Well, I added up what their request was, their shortfall. I think it's 905,000. If you look at the base that we funded and not 660.
So this is going from what was proposed in the budget. So this was the remainder after taking out the shortfall for special fund revenue. It does not include anything that they asked for over and above what the governor gave them spending authority for.
They requested 3.2 million. That's what I'm,
You're talking about grants to the network and so forth.
grants to the
Yeah,
network.
that's on the one time, another list.
But
Oh.
some of it's already in their base, grants to the network. So you need to look at their total appropriation line items and their grants line item.
Well,
And so what the House did was simply take out the amount that was the gap in the special fund revenue and backfill only 2 million of the 3.2 they took out.
oh,
So they left them with a $1.3 million deficit,
and we're leaving them with zero.
and you would be leaving them with zero.
Okay.
But they would still have the
I
600 would still
maybe
be
I
pressure
added
in their
up
budget.
wrong because I was looking at their request.
Which is over and above getting to zero, so that their deficit and their positions are funded. They-
No, I think this says 3.2 million.
All right, well, we're taking care of the 3.2,
Okay,
between the 2.5 for positions and the
Well,
6.6.
maybe this calculator's no good.
Maybe you got your finger on the wrong button.
Gotta be thinking there.
I'll ask about the revenue. Aside from the problem of the revenue.
Maybe it's just calculator's terrible.
Well,
No,
that could be, or it could be the
You
operator.
think? You're suggesting I can't use a calculator?
So is the committee wanting to do the 660 of one-time money?
What does it do?
Yeah.
Yes,
I'd
it
like to-
fills a deficit.
It allows them to be funded at the level proposed by the governor for FY '23.
I don't,
It does remain pressure.
I still think this is
Programmatic pressure.
300,000 off. I'm sorry, Stephanie, but I still think it adds to 300,000 off. But I,
Okay.
How can it be if it's 660 plus 2.5?
well, you had
Do you know if there was an
2.5.
I'm trying to see if there's a request above and beyond.
The governor's.
Yes, there is.
Yeah.
They had a lot of requests. They wanted grants.
They asked for 2.3 for the Victims Assistance Program. Call it 550,000 for other other
So that's a backfilling of federal
Projects.
money.
that have been supported with federal VOCA funds. Is that what we're not doing?
So that is on the
Not on this
one-time
list.
list.
That's
That's on the
different.
one-time ask list that we'll get to next. But that's not, the House didn't even entertain the asks above the governor's recommend.
Okay, so that's what we're not doing is supplementing the loss of federal VOCA funds.
Yes, that's correct.
We are not going to do that, is that correct?
It's an ask.
Not here.
Yeah.
Not here.
It's the next worksheet you get to when you try and fit into the one-time box that's remaining.
So maybe it's not the calculator, maybe it's the operator.
I think, well, now that we have that on record, I'm gonna move along. The 660, I would recommend we accept because it will deal with getting the deficit cleaned up. And then whether we want to do some additional money for grants to the network, et cetera, will be the next.
I recommend we do, but that's a different.
So the next item is the incident simulator at the training council. And there is additional asks that's also.
On the other list, right, the
On the other list.
550,000 for the,
Yeah, the 50
Testing.
Yeah, the 100,000 simulator.
well, the 100 is here.
Yeah.
You
no,
wanna
yeah,
keep it here?
Okay.
Yes,
Okay.
Are you looking for money down at the bottom of this? Because if they've been getting along without the simulator, this is,
I think,
Well, I
I think that the whole issue of how we train law enforcement to deal with situations so that they're not escalated and people don't end up shot, I guess, you had to put it
I mean,
bluntly.
there was a guy with a taser last night.
Oh, I-
They had the video. He was trying to tase a suspect. The suspect got his taser and then he shot and killed the guy. The officer shot and killed the guy.
So,
This is the one where he's on his back.
oh,
Yeah, terrific.
oh,
He shoots him right in the back of the head.
Where's that? No.
Michigan,
Yeah.
gosh.
Fort Michigan,
So I
or
think,
Grand Rapids.
I think in light of the need to know how to respond and be trained to these situations, we should, Bobby, I don't think this is gonna, I think we can accommodate this. We can always come back, but I do think how we train law enforcement and how they de-escalate and deal with these situations make the difference whether someone survives or whether they don't, too frequently. So the next one is 8 million.
We have to do that. Right,
We do, the question is if we had to find a little money, that could be a little less, but, so that, we have to do, some for the match. So that's just sort of to asterisk.
Just the House, the governor had proposed 10 million, the House chose 8.
What is the actual number that we have to do?
It's not a known.
No, it's sort of anticipatory.
Okay,
And you do have, these are the pieces that aren't FEMA eligible and aren't.
And the problem is if you,
there is
Don't-
the undershoot.
yes,
Commissioner, if you want to shut that line, go ahead. I mean, I hate to see you standing there like you're thumbing a ride.
I'm a fan of sun, and the sun makes people feel better when they're
it's
working.
called ride hailing. I just learned that in transportation.
Oh, it's right.
Yeah, it used to be taking out your thumb and give you a ride.
We don't detox people anymore. We don't.
No, we now hail a ride.
And hunting with the aid of dogs. And hunting with the aid of dogs.
I just need this new book of all the proper etiquette.
Well,
phrases.
we really missed you.
I just,
Okay, I'm gonna keep going. We moved the legal aid money knowing it was an ongoing, need
Yeah, I don't
into
think
the
that's
base.
gonna go
No,
away.
so we moved that to the base. Okay, now,
So now, this piece we just talked about a lot, this is the one-time part for the SUV
and so we'll have to gig that up by 1.5.
1.5, right?
Yeah, and we'll just move.
And then if you actually move your $13 million target down on the base,
Yeah.
you're in the same position.
Yeah, that's, yeah. You got it, Stephanie.
It's a little bit. I wasn't sure if that's where we were heading
Well,
toward
that's
now.
what I was communicating to
You
you.
know?
That happens when you're around someone so long. You finish each other's sentences.
Yep.
So,
The recovery centers, obviously, I should have had the word in the base now. That's you
in
put
the
that
base,
Yeah.
they're in the base. We're in the money, honey.
Well, what I would say for anybody just listening, that it may be in one time, but it isn't a traditional one time because it's envisioned it's going to
We put it in the base.
No,
The one piece, the Polish piece.
no, I'm saying for people that are listening, when you refer to that money as, did we put this money is envisioned to carry on with the opiate money, so it's not, it may be titled one time, but the functions
No,
we're continuing.
No, we took it off the one time. The house did it one time. We moved it to the base. That's why over on the right, under
you
the
don't see
Senate
it.
column, you
That's
don't
why it's
see it.
zero.
Because we
Here,
moved
wanna
it.
use this?
Take a pill.
So, take a value and I'll be right down. Okay. So I think we did exactly what you want.
Yeah, but we split it, half.
You're on prevention now, not recovery centers. We put the full 540 for recovery centers into
Yes,
the
we
base.
did. Oh,
Okay.
you're down to that, okay. All right,
Yes, I do.
you moved past the 1.8.
I did.
No, she said,
Okay.
I went over that.
I did, because we've
I'm
already
happy
resolved.
with it. Happy with what
All right,
you're
all right, Senator Westman is happy, let's move on before he.
Next item here, is, I'm a little unsure, there's the potential to do this in FY '22 tobacco money, assuming it comes in as expected next week.
Okay,
Okay.
so that's great, we're gonna have the money in 22, and so we'll
It'll just carry it forward to
Yeah,
get used.
okay. Agency education,
So these ones I had in green also, because I wasn't clear how closed these were in your run through last Friday.
child nutrition grants.
Let's go to them.
How does that fit with the 19 or 29 million the House just spent on school lunches?
Well, we have
Different.
different, it's different.
Different bucket of money.
Is this for schools to purchase?
Local foods, actually, it was the item on.
Bobby's,
Okay, so, well, we don't, do you think that they're purchasing non-nutritional food?
From farmers?
No.
No.
But they
It's like purchasing local rather than child
Yeah,
nutrition.
okay. It's to help schools purchase local
Yeah,
foods.
they report 35% of what they're buying now is coming local.
Well,
Right, but
good.
the title is child nutrition grants, it might be better, a buy local type of.
local nutrition.
All right, so
right,
do we
local.
want to do, I think 500 in the money?
Yeah.
I mean,
I
here.
think
we
we may
want-
have had a request from AOE about this, because it's difficult to purchase local in winter
Oh,
time.
particularly in winter time?
All
Yes.
squash.
That's not that one.
So
It's nutritious, no, you.
my squash is long gone, but I have braids of onions, and I have potatoes, and I have carrots, and onions and shallots and garlic. What?
Sounds like
You
good
love
food.
those. Actually, when President Garamella came to lobby me for more money for UVM, I have a photograph standing in my shed, with the onions hanging down. I gave him eggplants and I don't remember what else. You know, I've never taken the garden course. That's all been on-job training. And I've never taken home ec either. So no wonder I don't know how to cook. I
Well,
don't know.
is your
My
food
God,
nutritious?
you're not coming in with too much stuff. I haven't seen that nice cake with the
Oh,
rest.
yes.
Me either.
Oh,
Well, if we get this budget out tomorrow, I will, Monday, I will bake a cake. What variety? But we can take
I
chocolate.
hope not.
Huh?
You're not coming in on Monday, that's what you're.
No, I'll bake it Monday.
No, that's Patriots Day.
I think I'd take.
Oh, you mean I
the day
shouldn't
off.
cook on Patriots
I
Day?
think you
You
should
know,
take the day off.
just-
You're living in Massachusetts in March
Headed on
and
the
May, you
backside,
take the day off.
Sugar and Maplewood.
Why don't we skip that?
All right. So I'm gonna keep going, or there's no cake.
Okay.
Ethnic and social.
That's that study, that,
Equity, I think,
Act one.
yeah, we have to do that. The learning centers, that was from adult basic ed.
Mhm.
All right, we'll agree with the House on that. State colleges, we need to deal with this, and that's on our other list. We believe it, Stephanie.
and the capacity of changing, moving the DOL to the contingent list part of
So
it.
we're gonna move, this off because we're gonna cover it fully with ARPA.
At 14.9,
Yep, that's the commitment in terms of the transformation.
you kept talking about 12 million.
Well,
it reduces, if we do the 14.9.
no, but because we're using a different funding source, all of it is coming out of ARPA rather than the
Yes.
split. So that's why
Yeah.
you're seeing the full amount here.
Okay,
Okay. Support,
The global warming.
global warming, we felt we passed the legislation, we thought to support it.
No.
Wetland mapping, that's in addition to the, yeah, that's,
That's different than the mapping and the
Yeah.
environmental justice.
Yeah.
wetlands. I love wetlands. Adaptive and skis, we really closed that, we'll keep going down to green. Enhanced, 911 board.
So this one I would have zeroed out, but we got a lot of pushback for the idea of using that connected.
Yes.
oh, I know, the CAB, the CUDs
Yeah,
are upset about the 1.3.
and they are now putting it into their budget that they're building for 23.
They didn't have a budget, we really didn't have them in our budget process the way anything else is. We had language said up to 1.5 million and, so they are developing a budget and they do plan to use this, and I imagine that we've all heard from our CUDs.
All of them.
All right, so, and in light of that,
I've heard some that I don't have.
well,
From mine, you heard from mine.
how many memos did I get from
Oh,
Bennington
I
saying, huh?
And you're still getting them because they don't quite understand it's in.
Yeah, you forgot to tell them.
Okay, so-
I will tell them, they didn't
So
understand.
committee, we've finished the sheet.
Have finished this sheet.
All right, so now we're gonna move along.
So just to, just to understand what you have available in the one-time general fund arena, I'm assuming that you are reducing that base target, so the 1.5 does not have an impact here. You still have 3.9, just shy of $4 million. And the other item of one-time capacity that you have is what the House set aside in what they call an IIJA reserve. They had a number in there that was 7.2 that we had forgot to account for one of their bills, so that number is actually 6.8. So the combination of this $4 million almost and the 6.8 would give you $10.8 million of. That was, when the 1.3 came back on, the number got a little lower, obviously. So you have $10.8 million of capacity, of general fund capacity to work with for the next worksheet.
Okay, you wanna take a break?
Yeah.
Okay, yes, what time is it? We don't- Okay, why don't we break till 3, and then we'll be back.
Good, thank you.
And then, we will go on to our next sheet, because this is, gonna